Hello and welcome, good people. Once again, I'm back with another episode, and this time around, we'll be discussing about understanding suicide. Lately, and especially now, I've realized that so many people are committing suicide because maybe of so many reasons, and I decided to just focus on that for this episode, try and explain on the understanding of suicide, the awareness, the prevention, and maybe a little bit of hope. So, welcome, and I hope you enjoy, or rather learn something from the presentation. So, the purpose of this presentation is to increase understanding of suicide, reduce stigma, and recognize warning signs, and also learn how to help and seek support. So, welcome. I know that this topic can be a little bit emotional. So, yeah, I just hope that you'll be able to stay up to the end of it. I hope not to take too long. It's just a little bit that it's just a small thing that I prepared, and our objectives on this topic is by the end of this session, I expect that we'll have been able to understand what suicide is and what it is not. Also, will have learned common risk factors and warning signs, and also know how to support someone who is at risk, or even know when and how to seek help. Sorry, I know that, or to me, I understand that this is a very important topic that we should all be able to discuss or talk about openly. But in most cases, people seem to see it like it's not something that we should be discussing openly. So yeah, that is the reason why I'm discussing it. So we'll start by understanding what suicide is. So suicide is death caused by intentional self-harm and often linked to overwhelming emotional pain. Not really a desire to die, but a desire for the pain to just stop, or whatever they are going through to just stop. So mm, uh, what suicide is not is that suicide is not a sign of weakness. It is also not an attention seeking, and also it's not caused by one single event. Most people who consider suicide can be helped, and many go on to live meaningful lives if they are helped. So you can go to risk factors and warning signs. So common risk factors in suicide are things like a prolonged depression, anxiety, and trauma. There are things like substance use, that is alcohol or even any other drugs. Then there are things like major losses, maybe death, um, divorce, there's loss of job, and there's another thing like chronic illness or pain, something like previous suicide attempts, and there is also something like social isolation or stigma. These are the common risk factors. Then there are warning signs or things uh, you can watch for. Things and they are categorized in three different parts. That is emotional, then there is behavior, and there is physical. I'll start with the emotional, which is under emotional there is hopelessness, is also feeling like a burden, and there is extreme guilt or shame. Now this is something a person, what someone is experiencing, and another person might not be able to see it, but there is the behavior that someone else can notice or someone else can see. Things like talking about death or wanting to disappear, and there is withdrawing from others. These are the things that you look, you watch for in someone else, yeah, and especially when uh, they're experiencing the fact the common risk factors that I've just talked about earlier on. So talking about death or wanting to disappear, there is withdrawing from others. Someone who was always social, friendly, and they always loved being around people. You realize that they start withdrawing from everyone else. They just want to be isolated and stay alone. Things like giving away possessions, and by giving possessions, I mean things that someone or very important things to that person. You might realize that there is something someone held so dear to them, and they are just starting giving them away. That is another sign, an alarming sign, and they suddenly come after distress. When someone experienced a loss or experienced a very traumatic event, and they are just so calm, that is a call for alarm. On to the third warning sign to watch for is the physical one. You realize that there is changes in sleep or appetite, the same way we were talking about. Like someone, either the sleep or the appetite is increased, or they are not able to sleep or eat. And there is fatigue. There is also neglect of personal care. Someone who is always neat and clean, and all of a sudden they don't care of how they look or how they appear. They don't take care of their property, and yeah, then that's those are the 3 points to look for in physical warning signs. Also, remember that warning signs are a cry for help, so we ought to take them very seriously. But also, you might note these signs and realize that this person is like kind of pushing you away. We talked about isolation, so it's for you to find a way to be able to help them, or to push to want to help them. We'll go to myths and facts. So there are 3 myths, and the first one is, when we were growing up, we used to be told that talking about suicide puts the idea in someone's head, but the fact is, talking openly can reduce the risk, and it can help someone feel heard. Another myth is that strong people don't think about suicide, but in the real sense, or in the reality, is that anyone can struggle regardless of the strength of faith that they have. We have seen people who were very who always went to church, or they are the people who always talk about God, but they do commit suicide as well, because it's like when people are going through mental health issues, they ought to look for ways to cope with that, and that is why sometimes we find them committing suicide. The last myth is that once someone decides, nothing can stop them, but that is just a myth. The fact is, most suicidal cries are temporary, and when with the right help, they can lead a normal life like everyone else. So how can you help someone who is at risk? There are things that you can do. uh, uh, I'll list 5 things that you can do. You can listen without judging the person. You can also take them seriously. Show them that you take them seriously of what they are talking about. Also, you stay calm. Ensure that you are calm as you listen to them. You can also encourage the person to seek professional help and ensure that you stay connected to ensure that they are getting the help that they need. What are the things that you should not do? When someone is seeking help, do not minimize. Don't tell them that it will pass or it's never that serious. Also, do not argue or lecture them. Don't promise secrecy. And also, don't leave them alone if risk is high. Those are the 4 things that you should not do to someone who is intending to commit suicide. There are a few simple helping steps, and this we call them ACT. So you can ask directly, you can ask the person directly, are you thinking about hurting yourself? And the care stands for show empathy and concern, and T stands for get help from a professional or trusted person. Self-care and protective factors. Uh, there are protective factors that you can have to ensure that you stay away from thoughts of wanting to commit suicide. You can have strong relationships with family or even friends. You can practice having faith or just being spiritual. Practice spirituality. Also ensure that you have access to mental health care. Have coping skills and have a sense of purpose. By a sense of purpose is the need to continue living. There are quick grounding exercise that one can practice when they're in a situation where they feel like they want to harm themselves or want to commit suicide, like the grounding technique exercise, where you can just place your feet on the floor, take 3 slow breaths. Also name 3 things you can see, 2 things you can hear, and 1 thing you can feel. After the slow breath, it helps you get back into the reality of things and what is happening, and it helps you calm down and forget what was overwhelming you. When to seek immediate help. You know when to seek immediate help when you start or someone starts talking about suicide. Also when you are having a plan, or when you are feeling unable to stay safe. Those are the 3 things that can help, that can make you know that it's time to ask for help. you can seek help by visiting the nearest hospital or health center that is around you. You can also talk to a counselor, a religious leader, or trusted elder. And you can also reach out to national or local mental health helplines. I don't have any at the moment, but I can always look for that and share with you people. And remember that suicide is preventable, and asking for help is an act of courage. Remember that your life matters. Thank you for listening, and I hope that it's something that can help someone out there. Let's live and not commit suicide. We deserve to live for as many years as possible and enjoy the goodness of God and enjoy everything beautiful in the world. So thank you for listening, and as always, please subscribe, comment, share, and I'll really appreciate. Thank you, but also share what you might want me to discuss in my next episode. See you soon. Bye bye.